2017, it's hard to deny that universal healthcare is the endgame of the Democrat Party, even if it remained under wraps during the Obama years. Some Democrats aren't even hiding it anymore. When Socialist Independent Senator Bernie Sanders introduced universal Medicare legislation back in September, his bill was backed by 15 Democrats, something the Washington Post described as a record level of support for an idea that had been relegated to the fringes during the last Democratic presidency. "This is where the country has got to go," Sanders said in an interview at the time. "Right now, if we want to move away from a dysfunctional, wasteful, bureaucratic system into a rational healthcare system that guarantees coverage to everyone in a cost-effective way, the only way to do it is Medicare for all." Sanders' model for a rational healthcare system that guarantees coverage to everyone is Canada, a country whose system he's talked up for ages. Trending, watch, kayaker catches $100,000 wreck on video. Back in November, the rumpled Clarence Theroux impersonator and current 2020 Democrat frontrunner made a much ballyhooed two-day propaganda tour of Canada's system with staffers, healthcare professionals and, most importantly, journalists. However, while Sanders was being shown the advantages of Canada's system by its supporters in a very conspicuous way in Toronto, nobody seemed to mention what happens if you're non-essential in Waterloo, Ontario, just 90 minutes west of Canada's largest city by car. A PDF posted by the Region of Waterloo Public Health Office noted that EMS services aren't covered by the Ontario Health Insurance Plan's universal insurance if they're deemed to be non-essential, and those who call for an ambulance could be stuck with almost half the bill. While most of the $500+ average cost of an ambulance call is funded by the regional municipality and THOA, the Ministry of Health prescribes a co-payment for every transport, the PDF reads. Residents with OAP coverage pay a $45 co-payment for essential ambulance calls, including air ambulance trips, and a $240 charge for non-essential calls. This may seem somewhat trivial, all things considered. However, it's certainly not the only way one can be deemed expendable by Canada's socialized healthcare system. Take the case of Jack Webb, a Nova Scotia man the Conservative Tribune wrote about in October. Related, Hillary falling apart, medical device still attached 2 months after minor injury. Webb, 68, was suffering from terminal pancreatic cancer but the option of palliative care, keeping the patient comfortable as the disease progresses, was never discussed with him, even though it's considered one of the most common courses of treatment for the illness. Weeks later, he was transferred to the Halifax Infirmary, where he was supposed to be seen by a specialist upon arrival. Instead, he sat in a chilly hallway for hours. When he finally did receive treatment, he was given a broken foot that couldn't pump fluid. When Webb was recovering from a scope test, his wife recalls a nurse yelling, "If he stops breathing, don't resuscitate." This is what happens when you're deemed to be non-essential by the Canadian system. Perhaps unsurprisingly, those Mr. Webb left behind didn't appear on Sanders' tour. Neither did an explanation of Waterloo's ambulance policies. Funny how that works. Please like and share on Facebook and Twitter if you don't want the Democrats supporting Canada's healthcare system. What are your thoughts on socialized medicine? Scroll down to comment below.